Our speaker is Dr. Matthew Mesi, a consultant neurosurgeon at the Ahmadu Bello University Teaching Hospital, Zaria, and also an international fellow of neurosurgery at Hull Royal Infirmary in the UK. He will be taking us through the theme of this webinar, which is the role of artificial medicine, artificial intelligence in medicine.
Okay, thank you very much. Thank you for the opportunity. I want to use the opportunity to thank the leadership of CMDA, National CMDA in Abbott, Zaria, and also the Professional Development Committee for the opportunity given to me to speak on this topic. So thank you so much. We'll just say a word of prayer. Father, we thank you for this opportunity. We pray that even as we look into this topic that is something of recent and something current in our practice, we pray you give us wisdom and understanding so that it will be for the advancement of your kingdom, even as we, your children, practice here on this part of eternity, in Jesus' name. Amen. Geoffrey Hinton in 2016, he made this bold statement. He's discovered as one of the godfathers of artificial intelligence. And in a meeting, he said, in 5 years' time, or maximum 10 years' time, we should stop producing radiologists because artificial intelligence is going to take over and even do better than what radiologists are doing. So that is how much artificial intelligence had been valued. And the aim of this presentation is just to highlight some basic roles of artificial intelligence in medical practice. We'll just go through some of these, and because of time, we'll just try to highlight key things only. Those who have seen this story before, when the whole thing started, was that of when a computer was produced by IBM. For those who use SPSS, you're aware that IBM is one of the companies that patent SPSS, which is one of the statistical packages we use in analysis of data. So they produced a computer which they played a chess. The name of the computer was Deep Blue. And then there was this gentleman called Gary, who was the youngest world champion in chess with 12 world chess titles in a row and was considered to be the greatest player in history. So that's the gentleman here. So this man here is just playing the moves that the computer asks him to play. After several rounds, the computer won world champion. So that became an eye-opener in the sense that a computer was able to win a world champion who was champion consecutively for 12 years. That brought up the questions of, could a computer therefore reason as a human being? Could a computer think and make moves that will surpass the ability of a human being to do? So artificial intelligence simply is simulation of human intelligence process by computer systems. That's it. How a computer will attempt to mimic what human beings can do in terms of learning, reasoning, problem solving, and this entity is what is considered to be artificial intelligence. I won't take you through all these details, but mathematicians were in the forefront of trying to see, in the early phase of artificial intelligence, it was all about having a computer system that can bring forth logic, maybe solving complex mathematical equations and things like that. But from 1960s, there was a shift towards knowledge-based system, and that's when the boom of artificial intelligence started coming up. In the sense that rather than the computer just solving problems, I remember as students in secondary school or primary school, when you can solve a lot of mathematics, they call you computer. So that's just the idea. That was what computer does then. But when computers began to be used to kind of produce information from information that is being fed into them. So you feed information into a computer and it uses it to make a deduction of something, then that was a complete shift from what was initially being known. So such was it that in those 60s, there was a boom. Everyone was, oh, computer, artificial intelligence. And then in 1973, there was a commission that was commissioned to look at the reality of this artificial intelligence. And James Lighthill released a report. And one of the summary I quote is that in no part of the field have discoveries made so far produced the major impact that has been promised. The report accused researchers of overstating the abilities of AI. And in history, that marked a period of what they call AI winter period. That means things began to slow down. People were disappointed. Also, there was a hype about artificial intelligence. But then there was another resurgence of AI again from 1990s. And that's what we're seeing now. A lot of things, a lot of softwares have abilities to mimic what human beings can do. So generally, we could look at artificial intelligence either as a strong artificial intelligence or a narrow artificial intelligence based on the ability of the system to be able to make deductions and make complex reasoning. So narrow artificial intelligence, they do specific tasks, narrow tasks. They lack cognition, but what they do it in such a way that they surpass human capabilities. So if you have, let's say, an iPhone or an Apple product, they have Siri. You can just sit up and say, Siri, open this for me. Immediately, Siri will just open it for you. Or if you have, let's say, one of the Amazon products, then you have something like Alexa. You can say, Alexa, open this for me. Alexa will open it for you. So those are, they kind of give you specific things. They are just good at the tasks they are doing. They are not tired. So those are weak AIs. But in general, or strong AIs, they tend to be AIs that will have some form of human cognition-like reasoning, being able to learn, understand, and apply things. So you don't just tell them, do this, and they do it. They could make suggestions for you. They could modify things. They could reason a bit. So far, there is a standard true general AI does not exist, but that's where we are. There is the weak one, and there are those who tend towards the general AI, who we attempt to give them information and they can make some deductions out of those information and then produce maybe solutions for us to use. Bringing it down to medicine, AI has been used in different fields of life, and so medicine is not being left alone. And it's estimated that at some point in 2026, AI can help to cut down the cost of running healthcare by almost $150 billion in the United States. And how will that happen? Fewer hospital visits. In developing countries, or maybe in the Western world, sometimes you hardly go to see a doctor except it's necessary, because you can request for your prescriptions. Let's say if you have hypertension and you are on regular medications and nothing has changed, your blood pressure is controlled, you don't need to be going to clinic to be seen. Your GP or whoever, you can just request for repeat prescriptions only, and you just keep getting them without going to go to the hospital. So these things can reduce hospital visits. And even in terms of treatment, artificial intelligence is believed that with this, if diseases can be detected early, then it can affect how much is being spent in treatment. So those are the places where people are looking at in terms of medicine. So Forbes, we know about Forbes. They tell us who are the richest people in the world. And then Accenture is one of the Fortune 500 companies in IT in the world. So they brought out areas where in medicine, artificial intelligence can have relevance, from administrative flows to image analysis, to robotic surgery, virtual assistance, clinical decision support, dosage error reduction, cybersecurity, and even in education and in research. So we'll look at some of these roles that AI have in medicine a little bit more. Some of them can be recategorized as either preventive roles, diagnostic roles, therapeutic roles, administrative, training, all the same thing. We can also look at them as clinical decision-making in the sense of diagnosis, prognosis, treatment, and even individualized treatment, or in terms of clinician workflow, getting information from patients' record, medical billing, rather than people sitting down, calculating how much is a hospital bill. AI just sorts it out so that human beings can do more important things than pressing calculators to calculate figures. Then there could be direct customer services. These days we have wristwatches that gives you your pulse, your blood pressure. So we're beginning to have other applications, and then robotic health generally. So I'll start with medical education because that's where it all begins. You never became a medical practitioner without going to school. And without wasting time there, two things are important. Game-like technology have been found to have application in medicine, particularly virtual reality and augmented reality. But the augmented reality is believed to have some more advantage than virtual reality. How does this come into play? Just imagine when you were in medical school, you were dissecting cadaver, and then you go to those dissections. There are people who are scared of cadaver. But apart from that, I know there were some times when we had to use some old cadavers because there were no fresh, new cadavers. And dissecting those old, dry cadavers were not funny because they were dry. So with AI, you can do cadaveric dissection in the sense that with virtual reality, you are not having a cadaver, but you are using your hands to do things with the help of artificial intelligence that you learn, let's say, to know where, let's say, an ulnar nerve is, or biceps muscle, where it attaches. You can learn those things without being exposed to cadaver. So one of these have been shown by this study where they put two groups of students side by side to do what they call mastoidectomy. The mastoid is part of the treatment when there is problems with abscess or some problems there. So one group, they taught them using the traditional method of reading the books and the rest, and the other group used virtual, they use an augmented reality. And when they compare the two, those who did the virtual reality training were much better adapted to doing a mastoidectomy than those who read through the books. Because in the books, you just imagine it. You don't, sometimes some of the things they tell you that there is a nerve, there is basal ganglia, you just read them and just believe them. It doesn't make sense to you. But when you use some of those AI, it tries to project to you in a way that it looks a little bit real, even though it's not real, but you have a better grasp of it. So this is promising in terms of education. Unfortunately, since our videos are not working, I can't play this for you. If you can't hear my voice, the voice of the audio of the video. So it's about robotic surgery. That's another place where this has found application, various aspects of surgery. I think presently different fields in urology, I think the standard of care in most Western countries when it comes to what we call radical prostatectomy for prostate cancer is robotics. So in the UK, almost all the trusts that I know around, they have robotic surgery. So it's something that is amazing how government or trust or hospitals have these facilities to do prostatectomies. I know back home we still do the traditional way of open prostatectomy, and then and this is amazing. Patients spend, let's say, 1-2 days, they go home, they have minimal incisions. Even for rectal cancers, colonic cancers, they use robotic surgeries, heart valves. So robotic surgery has come to stay because it leaves patients with minimal damages. The precision of the robots is beyond what humans can do on their own, even though the robots are controlled by humans. So that is part of things that now is the way to go. Recently in 2022, in Johns Hopkins, they produced another. They wanted to take it higher because most of the robots that we have today, they are controlled by humans. So it's just the arm of the robot that touches the patient and does the operation, but there is a human sitting somewhere who controls how those things are done. So they produced an autonomous robot that was able to do anastomosis of bowel independent of any human input, in animals anyway, not in humans. And when they compared what the robot could do with what humans could do, the robot did better. So they are beginning to think of possibility of an autonomous robot that can do operations without human input. It has its advantages: precision, enhanced visualization, steady hands. For those who are surgeons, sometimes, your hands can be somehow some tremors, so your hand is shaking. Those things are not there. Smaller incisions, reduced blood loss, shorter hospital stays. Main disadvantage, in my thinking, has to do with cost. And then what we call the steep of learning. The curve is very steep because it requires training and retraining. And then, you have to depend on technology. So those are the key drawbacks with robotic surgery. Medical diagnostics, I just tried to play a video of a gentleman that was described as the godfather of AI. He's still alive. He is a British Canadian mathematician that was involved in what's called the development of the theory of deep learning, which is one of the theories that is used in artificial intelligence. In that video I played, even though you didn't hear what he said was, that was in 2016, that he apologized, but he was making statement that from henceforth we should stop producing radiologists because anyone who is a radiologist is standing on a cliff in which the bottom of the cliff has already been eaten. So what he meant was that robots or artificial intelligence will take over the jobs of radiologists in 5 years' time, or at most in 10 years' time. That was what he said then, 2016. So, well, it has not happened, but definitely artificial intelligence have found a role in imaging and diagnostics. So with that, we're able to help in interpreting MRIs, CT scans, X-rays. They could help the radiologists in reporting things. Also in pathology, those artificial intelligence are good in trying to, those softwares or those systems are good in helping reading slides and some molecular data put together, which can be helpful to the pathologists in reporting things. I'll just skip this, but this is just like a paper which showed AI prediction and human judgment. What people think, something they just see that it's just a tool. Some are happy to have it as an assistant. So, well, I'll leave that because of time. So AI can also be used in management and administration. Like we said, electronic records, chatbots, and virtual assistants. Sometimes, you can call like those network telecoms, and then somebody answers you, which is not a human being, and tell you, sorry, the number you're calling is not available at the moment. So, so if these things are available, sometimes healthcare system can make use of this to minimize the rate of, let's say, what we call non-clinical staff, so that they can be used in other areas. People can call in to find out their appointment date, and an AI system can just tell them, give me your name, your hospital number, and then they tell you this is your appointment date. So these things have been used and have been found to be effective. In public health, AI have also been used to determine pattern of diseases, to predict models that will help in early intervention and preventive measures. So we won't go into details. Generally, when we have patients, let's say someone who has, let's say, diabetes, You could just say, okay, because he's slim or he's fat or because of one reason or the other, I'll place him on metformin, or I'll place her on glibenclamide, or I'll place her on any of the recent generation medicines. But the reason why you are doing that is based on studies that have been done on other human beings, not on the patient that you are seeing. So AI is believed to be able to usher in precision medicine, where I shouldn't just prescribe, let's say, calcium channel blockers because they say to do well with calcium channel blockers in hypertension. No, I should look at the AI can tell me that based on the genetic composition of this patient, this is the drug that fits him best. So that is precision medicine. And that will lead to better outcomes, lead to better results, less side effects. And those are capabilities that AI can do. So in terms of social well-being of patients, now this is not very common in developing countries, but in the Western world, it's a big thing. People like to stay independently. Old person, 80s, still wants to be independent. And the system provides it in such a way that you modify the house to make sure that the person can be able to carry on with activities as long as possible. So for people who have conditions like dementia, they can even forget that this is the road to go out of the house. So they can have what is called smart home. Smart homes are fitted with sensors that can tell them you've forgotten to off your gas, or you've not locked your door, or you've not done this, so that they can live safely. So that is called ambient assisted living. And these are things that AI is believed it can be of help in improving the quality of life of individuals with these conditions. Of course, in research, AI has been used in top search researches. Things like ChatGPT can give you idea of papers that you need to, or information on various topics. People have compared the accuracy or the ability of some of these AI associated softwares to see if they can give information that is accurate compared to humans. And that's what you see from this study about breast cancer. This application, ChatGPT, was 88% accurate. That's not very high, but so there are limitations to artificial intelligence. Everything is not just rosy. And the main thing has to do with data quality and bias. And what do we mean by bias? Now, artificial intelligence, what we need to understand is that for it to be able to give you a result, it is based on a lot of data that have been imputed into the computer, into the system. Use this data to give you an answer. Now, let's say we know that most of this data are mainly obtained from Western countries. So if you carry an artificial intelligence advice in an underrepresented group, or a group that their information is not well represented in the core data that's been inputted into AI, then you're likely to have a bias. You're likely to have a wrong output because the AI gives you information based on the data it has. So that is one thing that is a key limitation of AI. The next thing is interpretability and transparency. Now, let's say you are the doctor, the patient comes to you, you use an AI tells you that no treatment should be given. Now, the patient is asking you, how did you arrive at that? You yourself, you cannot understand how AI arrived at that. And the patient will not be happy if you just say, well, because the computer told me so. So that is what it's called. So there's lack of transparency. It's like a black box. I will show you a slide on that. So how the computer puts 1 + 1 and then arrive at a decision, whether it is a correct decision or not, you will not be able to say. You just have to just trust the computer. And that's not very nice for medical practice because it's not transparent enough. Of course, there are ethical concerns because you put a lot of data into this, which if there is a data breach, there will be a problem. So there is need for regulations, legal issues when it comes to AI, because once there is a breach in data or corruption of data, AI can give wrong advices because this can happen. Okay, and then of course the high cost. Just to give you an idea, as of 2012, the Royal College of Surgeons estimated that for a Da Vinci robot, a model is like 1.7 million as at that time. And that for patient disposables, when you're operating a patient, it's like £1,000 per patient. So just imagine if you want to do that back, let's say in Nigeria. So issues of cost will really be an impedance towards that. So this is what I call the black box concept of AI. Because you don't know, black box means it's an apparatus whose inner workings remain opaque to the outside observer. You know that the computer will give you an answer. The AI will give you an advice. It will tell you the diagnosis from the imaging or from the slide. But it is not carrying you along. So you don't know how it arrives at that. And so even when it makes an error, because you did not know how it works, you cannot say when there is an error or when there is no error. And remember that errors can occur either because the data the computer is using, there is an underrepresentation of a particular set of people, or there can be a virus attack, okay? And these are things that are of concern in AI. So the future, therefore, is trying to get systems that are transparent, where the clinician can be able to see the basis for the reasoning of an AI. I think that's the future. We haven't gotten there yet. So how is it in Nigeria? The National Center for Artificial Intelligence and Robotics is under the National Information Technology Development Agency. And it is believed that, well, the healthcare market in terms of AI will increase to like $0.13 billion by 2030, meaning it's a fertile ground and there is much that can be achieved there. I believe we can start with simple technology. You can look at what they call Ada Health. It sounds like a Nigerian name, but it's not. I think it's a software produced in Germany also. Ada Health, if you can just download it either on Google or any of the app stores. It gives you can give your information and start asking you, so what is your problem? Let's start with your name, your age. It asks you questions and then it can give you possible diagnosis. So things like that can, if used properly, which can be used in places like Nigeria, it can make services available in areas where there are no physicians, but I will think should be used under the supervision of healthcare workers, so that people will not abuse it. In Uganda, they've been able to launch a program called MS-Scan. I think we can check that up. It gives them opportunity to look at pregnant women and be able to see pregnancies that have a risk of complication. And that can just be, it was an easy way for them to detect those kind of pregnancies so that they can have interventions. So I think the main challenge, I think, in Nigeria has to do with funding and then the political will. But I think it's not beyond us to have one center, at least, in the country, in some of the many teaching hospitals we have, if there is political will and commitment for the sake of provision of higher services for our people. I think it's something that, even though we have a lot of other problems, I agreed, but it's about the value of life that we want to attach to our people. The last time I presented this, I showed this slide, and the question is, what do you see? I will have asked to hear your voices, but well, I'm sure you see a man on the screen and people sitting down. Well, that was not really a man. It's just an image there. So June 10, 2023, in Nuremberg, in Germany, ChatGPT led a Friday service and preached. So what you are seeing here is ChatGPT. They just used the image of somebody. So the ChatGPT did the praise and worship. 98% of the service lasted 40 minutes and preached. Video will have been nice, but unfortunately, you said you don't hear my voice when I play the video, but it's a video of the service that happened. I tried to follow it up, and then after the service, some people gave their comments about how it felt like. And I think two people captured it well. That some said it's monotonous, some said, well, it lacked that feeling. You know, if a preacher is preaching, and just imagine a robot is just preaching, you just keep preaching, give your life to Jesus, don't do this, don't do that, don't do this. He's not looking at the response of the people and adjusting to the way that a servant of God will do as he's been led by the Spirit of God. So this brings up concerns. What are they? Is it the right thing to do? Is it the right way to go? I will leave that as a question for us maybe to discuss because of time, which I've already spent the time allotted to me. Then I found these 12 article statements on artificial intelligence by, I think it's Southern Baptist Church, I don't know where, but they have like 12 articles, and it's very good. It's like a categorical statement of Christianity, of Christian faith, our stand on artificial intelligence. And you could see in Article 3, they said we deny that humans can or should cede our moral accountability or responsibilities to any form of AI. Only humans will be judged by God on the basis of our actions and that of the tools we create. So humans alone bear the responsibility of moral decision-making. And concerning medicine, there was also a categorical statement that we deny that death and disease, which are products of the fall, can ultimately be eradicated apart from Jesus Christ, because that's what some are trying to propose, that once we have the perfect AI, then we don't need anything again. You can do anything you want with it. So this is a very good document that is produced by this evangelical group somewhere. Video will have been interesting. So I started the presentation hoping I will show you the video of Geoffrey Hinton in 2016. And I wanted to end it with the video of Geoffrey Hinton in 2023, where he gave an interview to BBC. Now he has left Google, and he has come out now to warn people that what he has helped develop in terms of AI, there are a lot of dangers associated with AI. And it's not far-fetched. It's because when you give AI a lot of information, AI can execute any plan to perfection. So let's say AI has your bank account, has everything you have. This is outside medicine anyway. So, and he said, okay, make sure this person is bankrupt. AI can go to that extent and execute it by checking all your records and try to make you bankrupt. So he feels that there are some dangers associated with AI, and this is captured by what we call the Gartner hype chart for innovation. All of you will remember when phones came, everybody, BlackBerry, that was like innovation trigger. Well, I never had BlackBerry then because I didn't have money to buy it. But, then everybody BlackBerry. So at this point, it's like innovation trigger. Then there will be a media hype. Then there will be a peak. So peak inflated expectations. Then things begin to go down. A trough of disillusionment. People now, after all, BlackBerry, there is even something better than BlackBerry. Then things go up a little bit and then they plateau. So for every technological advancement, there are these 5 phases that it might go through. And even AI, people believe, just the noise, maybe for some time, maybe we're still at this level of slope of encouragement, and may come when things may just plateau, then everything will find its level. So AI has demonstrated capabilities and potential in various aspects of medicine. It is adept for Christian medics to familiarize with these new innovations, cost and ethical concerns are formidable limitations, and Christians should be circumspect with times and seasons so that we can be able to have a stand as to what will be the proper thing to do, and not just fold our arms and allow others make decisions on AI on our behalf. That's some key references. Thank you very much for listening, and God bless you all.